One way to get Americans back to work is with an antibody test, something Dr. Anthony Fauci said today could be available as early as next week. But many health officials believe we still need a larger surveillance and testing infrastructure that includes diagnostic tests. Here's Dr. Narula on why that is so important.
The nation is ramping up testing. This week, Walgreens and CVS announced they are opening 17 more drive-through sites, which could test thousands more people. And the CDC just began using its own blood test to look at past signs of infection. But public health expert Dr. Ashish Jha says it's just a start.
What is our current testing capacity at this time?
We're testing about 130 to 150,000 people a day. That sounds like a lot, but for a country of 325 million people, it's not nearly enough. We need to be doing a lot more.
Test makers like Abbott Labs were capable of processing 1 million rapid response tests in the last 3 weeks. But according to the White House Coronavirus Task Force, it ran less than 10% of that.
I want testing to be ubiquitous. If I can do that, we know who's got the disease. We can isolate them. We can keep them separate. And then we can let everybody else who's not infected get back to work.
More testing for the antibodies that show previous infection and might tell us who is immune are also coming online. That could get people back to work faster.
Once the infection rates are down, if we have a testing infrastructure in place, we can open up. If we want our economy to stay open, this has got to be priority number one.
Nora, Dr. Jha was clear in saying that our problems with testing have been a federal failure. But if we prioritize building that strong testing infrastructure, we can get the economy off the ground in weeks as opposed to months.
Really important message. Dr. Narula, thank you.